we work so hard as dentists to get new patients in the door, but what we don't realize is the back door is also open and we're losing patients. And lots of doctors don't even look at those numbers. And so I feel like that keeping focus on our existing patients, our raving fans, or people who already love us will not only get more patients in the door because those raving fans will send more patients in, but you're also going to keep those patients who already love you and you're not depleting those numbers.
The other thing that I think is definitely true about what you're saying is that when you get patient referrals are the best kinds of new patients.
We're improving our dental skills. We're doing everything that we should be doing to take care of our patients' teeth and their health. And that's wonderful. That's exactly why we became dentists, because that's what we should be doing.
Welcome back to another episode of Dental Marketing Theory. I'm your host, Gary Bird. I'm the founder of SMC National, where we help you level the playing field against the big guys out there so you can grow the way that you want. And today I have Bobbi Stanley, Dr. Bobbi Stanley, who's the doctor and co-founder of the Stanley Institute. And she's going to share with you something that's going to surprise you, because we don't normally talk about this on the show, but how to grow. And it's not marketing. It's not about marketing. It's about keeping the patients that you have and closing the bucket. And she's going to give you the top 4 things that impact your office and keeping the new patients and keeping them happy. This was a great episode. You're going to love it. And it's going to really bring a lot of practical advice for you to grow. Stay tuned. All right. We are live and I'm excited about this conversation. I got Dr. Bobbi here today, and we're going to be having a conversation about growth. And I think you're going to really like this one. So Dr. Bobbi, why don't you tell me what the number one thing that you're seeing that's helping dentists grow right now?
So there are a lot of fun things that dentists want to focus on. They want to focus on external marketing, Instagram, websites, Google. But what I find that doctors can really focus on that will really help them get ahead is if they focus on internal marketing, which are their existing patients. So we work so hard as dentists to get new patients in the door. But what we don't realize is the back door is also open and we're losing patients. And lots of doctors don't even look at those numbers. And so I feel like keeping focus on our existing patients, our raving fans, or people who already love us will not only get more patients in the door because those raving fans will send more patients in, but you're also going to keep those patients who already love you and you're not depleting those numbers. So doctors are focusing on the wrong place. They need to be focusing internal and not external.
And now full disclosure, I'm a marketing guy. So I'm the guy that brings the new patients, but I totally agree with you, because a lot of times I feel like I'm just like dumping water into a bucket with a bunch of holes. And that's what I kind of equated to. And there's a couple of things that I find so interesting about the dental industry. Anytime that I say, hey, do you need more new patients? Every dentist says, oh yeah, absolutely. And I'm like, do you have availability? No. Do you have a hygienist that can actually see them? No. There's all these problems. And to your point, it's just like, fix it with more new patients. And yes, that will fix maybe the revenue problem that month, because those patients need more work. It doesn't solve the true underlying root problem of you bleeding out patients out the back door. The other thing that I think is definitely true about what you're saying is that when you get patient referrals are the best kinds of new patients. So a lot of times when I ask a doctor, like, what kind of patients do you want? They're like, good quality patients. And I'm like, well, what does that mean? Are you talking clinically, financially, emotionally? Like, what does that mean? Really, what they usually mean, without knowing that they're saying it, is they want patients that trust them and are going to listen to them. And guess what? Those are patient referrals. Marketing patients don't trust you. They do maybe 5 minutes of research, and then you have to like convince them on the phone, and then you have to convince them in the chair, and then you have to convince them to come back, and you have to build that trust. But patient referrals trust you right out of the box. And I always use this example, if I tell my wife to go call a dental office right now because they're amazing, and they don't pick up the phone, she'll call back. If they don't know how to answer her questions, she'll still schedule. If they schedule her 4 weeks out, she'll still show up. And then when she comes in and they go, oh, you need all this work, she's probably going to listen and say, okay, fine, and not push back. And doctors go, why did that patient do that and not the others? The reason why, this is a patient referral versus a marketing patient.
You're exactly right. You know, back in the old days, we used to have word of mouth, like people would actually speak to their neighbor across the fence and say, you know, who's your dentist? Oh, I go to Dr. So-and-so. These days, it's a little bit more challenging, and patients don't realize that you actually need new patients in the office. So there's still marketing that you can do that's internal with these patients. Of course, asking your patients to refer. And I love to say, Mrs. Jones, you're like the perfect patient. We love it. Every time you walk in the door, we love seeing you. Could you please send us more patients just like you? So now I've complimented Mrs. Jones. She knows that I love her as a patient. I'm not being dishonest. I'm telling the truth. And I would love to fill my practice with lots of patients just like Mrs. Jones. So, if you let your patients know how great they are, let them know that you have availability and ask them to send you patients, they certainly will. But you're also right in that you have to be able to take care of these new patients when they come in the door. You cannot have these patients come in 6 months from now because you don't have an availability for 6 months. You have to make sure that you have openings for new patients to come in the door.
Totally agree. So now let's talk about how to boost patient referrals. I'll share a couple ways that I've learned. It's like simple things, and I would love your thoughts on these, and then also an additional idea. So one of the ways that I've seen offices do this is when those patient referrals call or any new patient calls, and they say, "Hey, I want a new patient appointment." You say, "Sure." And then at the end of the call, you say, "Hey, is there anybody else in your household that's needing to get their teeth cleaned or needing their, a dental checkup?" And guess what? About 25% of the time, they're going to be like, "Oh yeah, my husband does. Oh yeah, my wife does. Oh yeah, my kids do. Oh yeah, my nephew does. Oh yeah, my kids are in town from college." And it doesn't happen every time, but about 25% of the time. So if you're getting 10 patients, all of a sudden you just turn those 10 patients into 13 new patients, which is really, really awesome.
Voting is open on Dental Woo's Top Dental Podcast. Starts on November 1st and ends on December 31st. Each vote supports the podcast. Last year, we won multiple top spots. And this year, we're hoping to do even better. This year, our goal is to get 1,000 unique voters on this podcast. Help us reach our goal, and your vote will count. Here's how to vote. There's a link right down below. Just click it, go there, and give us a thumbs up. That's all you need to do. Go to dentalwoo.com/vote or click the link below, and then find Dental Marketing Go, and then submit it. Super fast.
It's not unusual for the wife to be the one to call, and the wife will be the one who's going to start the appointment. And lots of times the husbands don't come in because husbands are busy and they don't see the need. And so I agree with you. If you ask on the phone and go ahead and get them scheduled right then, that's the way to do it. The other thing is we work so hard on making sure that we give great dentistry. We're great dentists. We're improving our dental skills. We're doing everything that we should be doing to take care of our patients' teeth and their health. And that's wonderful. That's exactly why we became dentists, because that's what we should be doing. But we also need to work on the empathetic side of dentistry, where we relate to our patients, where we help our patients see that we care about them, that we're not rushing them through the office. And unfortunately, insurance has gotten in the way of us providing that, because it's all about the numbers now, because insurance is given less reimbursement. And we have to slow down and be really careful about that, because we have to treat our patients the way they deserve to be treated. We have to let them know that we truly care about them. We care about their families. We care about what's going on in their lives. We care about their vacations. And you have to take time to have conversation and get to know the patient. So you can't go in and numb a patient and then walk out and leave them with the assistant and then come back in and do the treatment and then say, "Okay, Mrs. Jones, we're all done. You did great today. Thank you for coming in." You need to spend some time with that patient. So you need to figure out how to run your practice in such a way that you can actually spend time with your patients and get to know your patients.
That's a really good point. So, okay, so a couple of things. Number one, you're totally correct. The female, 75% of all medical decisions are made by a woman, a mom, a sister, a daughter, whatever. So it's almost always a female that's, and it lines up on the phone calls too. It's almost always the female that's calling. But I love your point to how to make the patient feel amazing through the patient journey. And we have this conversation all the time, because a lot of dentists out there think that if they learn dentistry, the clinical skill of dentistry, that will make everything amazing. And patients have the part that dentists struggles with so much is that me as a patient, I have no idea if you did good clinical dentistry or not, right? Like I have zero clue. All I know is I showed up to my appointment, you were ready to go, or I waited 30 minutes for the appointment, right? And then everybody was nice to me, or they weren't nice to me. And it hurt or it didn't hurt. It might have been, you could have a horrible, everybody's mean to me. The front desk cussed at me. It hurt like, all get out, but did the best dentistry is going to last the rest of my life, right? Or the opposite could be true too. Everybody, it's the nicest place in the world. Everybody's super kind to me. You get me in really, really quickly. Didn't hurt at all, but it was some of the worst clinical dentistry that I could ever have. Patients don't understand the difference for that. So could you kind of help me or help our audience understand, like, when you say, hey, you got to make sure that these patients feel a certain way, kind of break that down for me?
Yeah, I'm happy to. Robert Cialdini did it really great in his book, Principles of Influence, where he talked about what actually makes people say yes, what makes people move forward with treatment. And one of the things is people like to do business with people like them. I don't know who my patient is or how much I am like them until we sit down and I have a conversation with them. So I may say, Mrs. Jones, what do you do in your free time? Which is a very common question that I ask all new patients. What do you do on your free time? And she may say, I love to run triathlons. And then I could say, oh my gosh, I've done a couple of Ironman triathlons. Have you done Ironman? No, I haven't, but I want to. Now we're connecting. I'm like she is, she's like I am. We're starting to like each other. So people want to do business with people like them. And it may be that you don't have a common bond, but you can find something like my uncle ran triathlons. Have you done this triathlon? Tell me about it. Tell me about the biking part. Tell me about the swimming part. There's always conversations that you can get into with a patient, and patients love to talk about themselves. And you can literally say nothing. You can literally let the patient talk about themselves the whole time, and they're going to leave thinking that they had the best conversation with you ever.
Now, how do you get your team aligned on that? So I've seen different offices do this different ways. I've seen like the yellow sheets or the blue sheets or whatever, and it's like, this is Gary and his kid. He has 7 kids, and 2 of them are playing sports, and they like basketball, and Gary likes to golf. You know what I mean? So it's like, so now how are the kids doing? How, have you been playing golf? And it's like, is that how you guys recommend people do it? Or do you guys have a different way you approach it?
Well, for us, every single visit gets a personal note, every visit. So we always know the next time we see a patient, we have a touch. So Susie's getting married in the fall. And then I see Susie around the holiday season and I'm like, oh, tell me about the wedding. How did things go? I heard you were getting married. So there's always a touch. And sometimes we carry those touches forward. Like this patient loves to play golf and patient's on a golf league, so that we constantly have something to talk with the patient about. Also, in morning huddle, which I advise everybody to have a morning huddle, it's a great time to get to know your patients. As you review your patients, we review who has unscheduled family members, who has a birthday coming up, because there's nothing better than to recognize a patient's birthday when they're in the chair. And then anything special that we need to talk to the patient about. And you'll find that when these patients have these personal notes, team members remember. They're like, oh, she was in a month ago and she was getting married. Make sure you ask her how that went. So you'll remember.
Like, it's the lady who got married a month ago, right? Or this is the, yes. That's really good.
Yes. And then those patients literally become your family members. You become part of their family, and you travel through life's journey with these patients. And that's how you get the patients who come in when they're young, and then they become teenagers, and then they go to college, and then they get married. And now they're back with their spouses and their kids. And you have a whole nother generation of patients in your practice that just starts all back over. And there's nothing better than to be a veteran dentist who has a second generation patient in their practice.
That's really cool. I haven't heard a lot of people talk about that recently, and I think that's a huge goal. Another thing that I did a podcast one time, and I actually just filmed another one on it because it was so powerful. They said what they would do is to boost patient referrals is they would, every time a patient had treatment done by the dentist would call on the way home. They would call them, and they would have whatever, how many patients they did treatment on that day. And there was a certain level of treatment that they had to have or whatever that they qualified it. And then, so on the way home, they would call. Now, no one answers these, right? Nobody who answers the phone if you don't know the number, right? No one answers those anymore. So it would always go to voicemail. And they would just leave a voicemail. Hey, this is Dr. Smith, and just wanted to check on you, make sure everything went good. They said people went nuts for this. Like, after they started consistently doing that, patient referrals went through the roof. And then I met another doctor who had one that they did voice drops where they would just have a pre-recorded message and was just like, hey, this is Dr. Smith, blah, 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 blah. Just wanted to check on you. And they had a couple that they made and they would just drop them automatically. Their assistant would drop them into the voicemail. Same effect, right? What are your thoughts on that?
Every patient that gets treatment gets a phone call and they are shocked when the doctor calls. They really feel like that it's special. The other thing is we're serious about our after hours calls. Every single after hour call gets responded to by the doctor, usually myself, and I call for my personal cell number. And I always tell them, if you have any other problems, just text me. This is my personal number. And it seems weird that you would give, 3,000, 4,000, 5,000 people your personal cell number, but patients do not abuse it. And I don't mind them texting me because if they need me, I really want them to text me. And they just feel so honored that they can have my personal cell number so that at any time they need me, they're going to get in contact with me. And I've been practicing for over 30 years. I've never had a patient abuse that ever.
And the reason is, let's talk about why that's so special. Because I think people get mixed up on this and they're like, I don't want people texting me and stuff. But the reason that it's special is because nobody else, there's no other doctors that are texting you and saying, hey, text me, right? Like, it doesn't matter where you go and what you're doing and who you're working with. Like, it's a very rare thing. So when the dentist, if you say, man, I really want to stand out, I really want to be different to my patient base, this is the way to do it. Like, because no one else is doing it. It really makes you different.
They're so shocked when you say, this is my personal cell number. If you ever need me, just text me. Or if it's over the weekend and they're in discomfort and I give them some advice on how they can stay comfortable. And then I say, and if anything changes, just text me. I'm here for you. They're always excited and happy that they feel so special that I'm there for them. And that's what they want. They want to know that you're there for them.
Any other hacks or anything else that you would like to talk about? Because I know you guys, you teach people this stuff, right? Is that right, at the Stanley Institute? So walk me through, like, if I pretend I'm a dentist and I got a couple practices and I come to your institute, like what else would I learn that would help me with this kind of stuff to grow?
Yeah. So one of the things that we talk about is the, I teach the business of dentistry. It's called The Lucrative Dentist. It's a 2-day course. Day 1 of the course is for team members and doctors, and day 2 is for doctors and spouses, because day 2 is all about finances. Day 1 is about team building, culture, that sort of thing. And let's talk about culture, because that's part of marketing. When you develop a culture in your office, patients feel that. They come in and they say, man, everybody here is so happy. You guys just kind of jive. It's like you guys have been working together forever. So when you develop a culture and people start to feel it, they really know they're in the right place. It's not a place where people pick up the phone and they're like, doctor's office, can I help you? Hold, please. So some of the things that we teach in the class is how to develop that culture. We talk about that first phone call because that's so important to marketing, and how you can get information from the patient but not have the patient verbal vomiting on you so you're on the call forever. But the patient feels like they're being heard. And most importantly, Gary, is the patient is getting scheduled. Because you would be shocked, for every doctor that comes to my class, we do a mystery call to their office as if we're a new patient. And we ask, do you guys do crowns? How much are they? Every doctor, hundreds of doctors we've taught, of those hundreds, only 2 offices have we ever, before we hung up, only 2 have the person said, can I get you scheduled? Usually they answer the questions and then they hang up the phone and you're like, oh my gosh, they didn't even invite me to be a patient. So knowing that verbiage, and it doesn't have to be a script, but at least knowing that you have to invite the patient in.
And I save that next point and lock it in because I want to hear it. I recently did a podcast on a case study. So this doctor that I worked with, they started with us. They were spending $1,000 a month on marketing, maybe seeing like 5 to 10 new patients. They now see, this is a single location in the heart of Salt Lake City, in super competitive market. They're now seeing 150 new patients a month, and they did $500,000 in collections this last in May. And so I did a whole case study in it. And I asked him, he's in the high 80% of conversion on the phone. I said, how do you, because we trained him and we showed him, this is how you should do it. But I could tell they were doing something else on top of that. I said, how did you do this? He said, what I have my team do is I have them call other dental offices and just ask I say, which questions do you not like the patients asking? And then I have them call and ask those questions at these other offices. And he said it's so bad that they feel horrible. It makes you just feel icky that even just not, they're competitors, but they're like, I don't like that I'm in the dental profession and they made me feel that way as I ask these questions. And what most people don't realize about their offices, their front desk, they're not bad people. They're just busy. And so they're just like, hello. And it's like adding another new patient. It's just more work for them with really no advantage. There's no upside for them. So it's like, plus I got the doctor asking for something. Plus I got somebody standing there. And so as he had his team do that, and I asked him I said, how often do you do that? We could do it every month. And just so we remember. And I said, how out of all the offices that you've called, how many of them actually did a good job? And he said the same thing that you did. He said it was 2 out of 100 offices. And it's just so crazy to me because it's such a basic thing.
Isn't that amazing? And we spend so much time and so much money in marketing to get that phone to ring, yet we can't get the patient to go to the next level because of the way it's being answered. So it really is amazing.
It's so little too. Just like making somebody feel good and answering their questions like a nice person. It's not a hard thing to do. It's not hard to train. It's not hard scripting, but if you want, and just asking like, okay, what works better for you, mornings or afternoons, to get you scheduled? Like you just ask that at the end of the thing and all of a sudden people are signing up. And then these doctors are like, I can't get more new patients. What's going on? It's like, just listen to your last 10 phone calls or try to call your own office. I always challenge people, call your own office. So sorry to cut you off there. I really wanted to drive that point home because it was such a good point.
No, I want to dig into that deeper. I want to tell you, several years ago, we took our phones off the front desk, and that's made a huge difference because what happened was I had a team member who said, I think we need to develop a call center in our office. And I said, I'm not hiring more people. You know, it means I have to hire another team member. I've got to manage another team member. Payroll goes up. A whole nother team member just answer the phone. I don't see the benefit. So I kind of fought it for a long time, and she was pretty adamant we should do this. And finally I gave in and I said, okay, let's hire 2 people to answer the phones, and we'll set up little cubicles in a back office, and we'll just take them off the front desk and see how it goes. I will tell you, Gary, it has been the best decision we ever made because the phones get 100% dedication. Patients get their questions answered. They get invited to come in. There's no background noise. There's no people in the reception room listening to the people. No putting people on hold. Nobody listening to conversations. And people in the reception room have actually noticed. They've said, why aren't you guys on the phone? Because they're used to walking in and somebody being on the phone and saying, just a minute, I'll be right with you. Hang on. You know, that's typical in a doctor's office. But when the front desk is devoted to the people in front of them and the people on the phone are devoted to the people on the phone, it makes a big difference.
That split attention's big. The other thing that I've seen that's become really popular is getting somebody who's not in the office to cover the backup, right? So even if this is the tricky part about dental, it's like you have 2 people answering the phones, which is great. But if 4 people call at the same time, which is not unlikely around lunchtime or early in the mornings or in that. And so it's like rolling those calls over to a remote team. And there's different ways to do it. And I'm not promoting any one way to do it. It's just, you can easily train them and then get those people to answer the phones, and same kind of impact without adding another body. I've seen work really, really well. So that's a really good point.
I think the biggest thing is not putting people on hold. I mean, how frustrating is it when you call somewhere and the first thing they say is, hold, please. You're like, I was just going to tell you I'm going to be there in 5 minutes. I just wanted to let you know, now I'm on hold for 5 minutes. So it's very frustrating. So you're absolutely right. Manage your phones appropriately. The next thing I was going to talk about is when the new patient comes in, the experience they have that first time is powerful. So one of the things that we do, our office isn't that large, but we take a patient on a tour of the office because research has told us that when people know where the bathrooms are, they feel really comfortable. So we just tour them around, and we have photos of patients on the wall of different procedures that we've done. So we'll say, this is where we do implants, and these are some patients that have had dental implants. And we talk about the procedure and what we do. And that gives us the opportunity to let patients know what services we offer, because it has not been unusual in the past prior to doing this for a patient, an existing patient even, to come in, for instance, in Invisalign. And you're like, oh, you got Invisalign. Where'd you get Invisalign? And they said, the doctor down the street. Well, why didn't you get Invisalign here? Well, I didn't know you did Invisalign. So it's an opportunity for us to introduce our patients to the office, to introduce them to the procedures that we do, introduce them to team members if they bump into team members, and also let them know where the bathrooms are. So that first experience should be a really wow experience for that patient.
I know we could probably go on and on and on with this. This has been really, really good, but all good things must come to an end. What if someone wants to reach out to you and learn more about what you guys are doing? Like if they're like, man, this is good. I appreciate like your energy, your just enthusiasm. So I can only imagine what your classes are like. Where can people learn more about this?
Yeah, all of our information is online at stanleyinstitute.com. It's Stanley with an E. So stanleyinstitute.com, STANLEY.
Thanks so much for coming on. You did a really good job. This is an exciting and really good episode.
Yeah, it's been great. Thank you.